Singapore has confirmed its first case of
Most
the Wuhan
workplaces
virus.
across Singapore have shut as the country begins what's being
We will
called
therefore
a circuit
extend
breaker.
the circuit breaker for 4 more weeks.
Coronavirus.
When COVID-19 struck Singapore, we knew we had to act. Our campus has over 50,000 students and staff spread over 200 buildings. It's a place where people congregate, students attend classes, research conferences are held. In our lab, we were motivated to develop in-house capabilities to assist the university in the event of an outbreak. Our goal was to research effective methods for identifying infection hotspots and for contact tracing. If the virus struck our campus, we would be able to quickly track down contacts. Wi-Fi data was an obvious choice since it's ubiquitous in campus. Staff and students alike often connect to the access points spread around the campus to perform the work which leave trace of their location and co-location with other users. The data contains inconsistencies, and apart from technical challenges, Wi-Fi data is biased by human behavior. Some users are connected 24/7, while other users use their cellular data plan so they are completely invisible to a data set. Our research paper describes how an analytics system for outbreak investigation and contact tracing can be operationalized from Wi-Fi data. All of the system components are described in our paper, and we made all the code publicly available and open source in GitHub. Our system was developed in a secure environment in which only NUS researchers who must abide by the NUS Social, Behavior and Education Research Guidelines were allowed. The ethical aspects of our research were reviewed by and approved by NUS Institutional Review Board. The Wi-Fi monitoring system is outside of our control. The University IT department prepares the data for us. We download the prepared data as CSV flat files, which are stored in our server. Session logs are created every 5 minutes for every session which is open or was completed within the pod interval. The information collected includes unique individual identifiers which are hashed for privacy purpose, access point names, and session time attributes. We ingest the raw logs into the data warehouse using Airflow tasks. One task ingests the data, another task consolidates facts to ensure that session information is consistent and not duplicate. New dimensions are flagged in order to populate them with attributes later. The data warehouse is where the data is stored for analytics purpose. A data warehouse is a database architected to facilitate the organization and analysis of operational data to support decision making. Our logical model follows a star schema. At the center, you find the facts table that stores the measurable and quantifiable grain of analysis, as well as pointer to dimensions, which include days, locations, users, etc. Data warehouse queries are kept efficient because the dimensions are kept in separate tables. The fact table is partitioned by session start time, and we index session times. It also contains views, which are aggregated and processed facts to make analysis consistent and even more efficient. Our data warehouse covers 50,000 students and staff spread over 230 buildings during 286 days. In total, we have 385 million entries in the facts table. The data warehouse is connected with back-end servers, which serve aggregate views to front-end analytical services.
In the crowding feature, the user selects the time period of interest. For example, April 2020, Singapore's circuit breaker period. The crowding level at each building floor is displayed as a 3-dimensional choropleth, and the crowding levels can also be displayed as aggregates. The user can observe how crowd levels change over time by adjusting the playback controls. Crowding hotspots can also be identified by viewing the average crowding levels during the time period of interest. In the contact tracing feature, Contact Tracer marks the target user and defines the time period of investigation. The app displays a Gantt chart, which reveals all users who have ever shared the same Wi-Fi access point as the target user. a time-lapse of the target user's historic location is displayed, allowing us to track the user's movements. Contact tracers need to know which users to call up first. To facilitate this, they can also view a bar chart of users sorted by total time spent sharing the same Wi-Fi access point with the target user. In the Outbreak simulator, the analyst determines simulation parameters, including initial targets and infection rates. The app displays a choropleth time-lapse of cumulative simulated infections to help the analyst identify potential infection hotspots.
A key problem with Wi-Fi data is that it collects information about devices and not people. Our heuristics attempt to capture sessions that most likely emanated from a mobile phone, which nowadays is carried by most of us. We create a dimension for user MAC tuples in our schema to hold information about which devices are mobile and which are the primary devices to target in a day. We follow only their primary devices. For our applications, we were most interested in events where a person is stationary for a minimum period of time. Therefore, we opted to create a view of the facts table with sessions merged and filtered. We merged sessions from primary devices that take place in the same access point within 10 minutes of one another. Following this procedure, we reduced the facts table from 385 million entries to a table of 13 million sessions. A key novelty of our application is the integration of an epidemiological simulator to assist policymakers in identifying hotspots. The simulator allows us to investigate hotspots and determine optimal intervention zones and times. The contact tracing application is built to support public health officials who are conducting contact tracing. It does not replace manual contact tracing, nor does it send alerts to users, but it's meant as a recall mechanism in a similar way to Trace Together, used by the Singaporean government. Identifying infection hotspots through simulation goes beyond identifying crowding hotspots. Epidemics spread in a community through the combination of both super spreading events, which could take place in a crowded environment, and through heterogeneous relationships that individuals develop through daily interactions. In our current demonstration, the simulator will depict the number of cumulative infections per building. We could also use simulator outputs to identify the most important transmission channels between buildings. Our disease simulator is developed in Julia. Rather than iterating through the population one step at a time, the disease outbreak simulator is an event-driven simulator. It uses a priority key of infected individuals to keep track of infection events. While the queue is not empty, we pop the individual with the most recent infection. Simulation outputs are stored in a data warehouse. Simulation requests are handled by the Julia backend server that determines whether to fetch pre-stored results or to trigger new simulation runs. The simulator requires that we pre-compute a view of contact events. We only compute collocation events based on our aggregated view of the facts table, which reduces computation time. Nevertheless, there are still important bottlenecks in our implementation. The simulator either requires that the full contact list be held in memory, or that we make very large number of queries to the database. We are still investigating the most efficient way of performing fast simulations on such a large amount of data, in order to serve results in near real time to the analyst.
Our app is built on top of DeckGL with Mapbox as the map library. We chose DeckGL as it is modular and open source, which gives us the freedom to design and build our own custom visualization layers. The user is free to hover the cursor over any building floor to view detailed information, such as the building's name, the floor number, and the number of Wi-Fi users currently present, all displayed on the sidebar.
Pandemic spread of infectious diseases is and will be one of the biggest threats to the society and the world. It is likely that COVID-19 will not be the last pandemic that we will face. The platform that we are developing in this project can improve our ability to exploit the mobility data effectively for combating the pandemics. It will also inform us on the limitations and weaknesses of the current methodology and approaches. Therefore, we will focus on our research towards addressing these limitations and weaknesses so that we will be well prepared to use data science to save lives for current and future pandemics.